Dr. Patel had kept the files for 4 years, not as research. She was a family practitioner, not a researcher, but because the pattern was consistent enough that she had stopped knowing where to put it and had started, instead, keeping a folder. The folder was in her desk drawer. It was labeled, in her handwriting, with a title she changed 3 times before settling on, Animal Alerts Prior to Presentation. It contained 14 entries, 14 cases in 4 years, where a patient or the family of a patient had mentioned, at some point during the appointment, that their pet had behaved unusually in the days or hours before the medical event that brought them in. She had not solicited these accounts. They arrived with the same organic spontaneity as any other offered context in a clinical appointment. I should also mention, the cat was acting strange. The dog woke us up. The parrot kept saying something that didn't make sense until later. She had written them down because she was a systematic person and systematic people document patterns, even when they do not know yet what the pattern means. The 14th entry was the one that made her decide to show the folder to someone. If you stay for stories about what animals sense before we do, you are in the right place. Subscribe so you do not miss the next one. The 14th case was a family with a 3-year-old named Jonah and a Doberman named Brix. The parents had brought Jonah in for a fever that had been running high for 2 days. During the intake conversation, the father mentioned that Brix had been behaving differently for 4 days, that he had started sleeping outside Jonah's door rather than in the bedroom, that he had been pressing his nose against Jonah's neck and behind his ear at intervals throughout the day, and that he had refused his food on the first day of the behavior change. The diagnosis was a developing mastoid infection, a bacterial infection of the mastoid bone, the structure behind the ear, that had started as an ear infection and progressed to a stage that the pediatric specialist told the family required prompt treatment. It was caught at a stage that was, in the specialist's clinical language, favorable. Brix had changed his behavior 4 days before clinical symptoms were significant enough to bring Jonah in. The mastoid infection had been developing for longer than that. Dr. Patel looked at her 14 entries. She looked at the 4-day gap. Has your dog ever done something that made no sense until it was the only thing that made sense? Tell us in the comments. These stories deserve to be heard. She brought the folder to a colleague who worked in veterinary medicine, an old friendship from medical school, before her colleague had made a different choice. He read through the 14 entries over lunch and was quiet for some time after. He said, "What do you want to do with this?" She said, "I don't know. I'm not a researcher. I don't have a methodology. I have a folder," he said. "What do you want the folder to become?" She thought about this. She said, "I want someone with a methodology to tell me whether this is real or whether I have been noting coincidences for 4 years. He said, "The question you're really asking is whether the detection precedes the presentation." He said, "That would require a controlled study." He said, "The detection mechanism is known. You can read 30 papers on canine olfactory detection of bacterial infection alone. The question is whether it is occurring in the domestic, incidental way your folder is describing." She said, "Is it possible?" He said, "All 14 of your cases are biologically plausible. Not one of them requires anything beyond documented capabilities." He said, "I think you should write a case series." She wrote it. It was published in a small clinical journal with a limited circulation and generated within 3 months 14 responses from practitioners who had their own folders, not labeled the same way, some were in memory only, some were in informal notes, some were in patient files under miscellaneous context. But they were there. Every guardian deserves to be recognized, even the ones who never asked for anything in return. If stories like this matter to you, subscribe so you never miss the next one. Dr. Patel kept the folder. It had 22 entries now. She was adding to it more systematically, with consent from the families and a standardized intake question that she had added to her general history. Do you have pets, and have they shown any unusual behavior before this illness or symptom? The question produced answers approximately 1/3 of the time. Not all of the answers were significant. Some were coincidental timing. She was certain. Some were not. She was learning to distinguish between them, which required exactly the kind of methodical observation that had led her to keep the folder in the first place. Brix the Doberman came back for Jonah's follow-up appointment. The family brought him to the waiting room, which was permitted at her practice because Jonah had requested it. The boy sat in the chair, and the dog sat beside him and Dr. Patel, on her way out of an exam room. Stopped and looked at them for a moment before she was seen. She thought about the neck, the 4 days, the mastoid bone. She thought about what it meant to have been running clinical tests on patients for 14 years, and to have missed, for most of those years, that there was another set of results available in the waiting room.